Alright, and here I'm going to do my scale, my IV insertion scale. I have checked my physician's orders and I see that he wants me to start a saline lock for blood on my patient here, Mr. Aniston. I know right away that I will need an 18 gauge cannula and I will need to put the blood in the forearm. Okay, so I would ask the patient, first of all, whether he's left-handed or right-handed. I would check to see if he has a shunt for dialysis. I would check to see whether he's had a stroke or any other difficulty in a specific arm, and I would stay clear of that arm if there was issues in it. I'll put it in an arm that, you know, has no problem. Also, when I go in to get the blood, if there was a vein, you know, if the veins were not popping up nicely and I couldn't find a good vein, because, you know, with giving blood you need a nice big vein, I would have him do a fist, or I would put a warm pack on the site and leave it there for 5 to 10 minutes, and that would have the vein pop up nicely. So those are the things I would do in order to be successful in this skill. Okay, so now I'm going in to look for my vein. I am tying my tourniquet and as I said, it should be in the forearm, but I'm going to just improvise, you know, and I will put it in the hand down here. But I would look in the forearm because the veins up here are a little bit bigger. But let us go down to the hand here and try and find a vein. I know I need a vein that is 2 finger length in length and one that is really nice and bouncy and with no problems. So looking for the vein, I think I've located one like right here, let's say right there, and so I think that's where I will go. So I'm releasing my tourniquet and I'm going to get my ChloraPrep and have this all cleaned up and ready to go. Okay, so here's my ChloraPrep right here. I would take my ChloraPrep, put it away from myself and the patient. I would squeeze the handle, pop it, and I would clean it really nicely back and forth to activate the ChloraPrep. That's how it works. And when it's all nice and clean, I would be done. Put it back right in here. While it's drying, I will just get my other supplies all opened up. So I have here my 18 gauge cannula, and it's in this little case and it's sealed. So I would just twist it to break the seal here and leave it right here so it doesn't get contaminated. And I have my Tegaderm. I would open that nicely. Alright. Then I would go to my 2x2 and get it opened up. Okay. Good. My tubing and my syringe, my 10cc syringe. So I get my tubing all opened up. Alright, so it's right here and it's open. Get my 10cc open up. Alright, I have it all. Right away I will prep my tubing and get it ready. So I will take my normal saline and I'll put it like this, and we'll just loosen the top here to make sure I have no problem. Press it right in here, and I think I am all ready to go. So I know that I have all my ingredients. I'm going to just my supplies. So I'm going to just wash my hands and put on my gloves. So here I am. I'm washing my hands nicely. Okay, and then I get my gloves on. When I go into the vein, I know I have to use a 30-degree angle. I also know that when I need to mention that in tying the tourniquet, it needs to be 4 to 6 inches above the site. So I'm going to do this. So I am going to get my cannula, and I'm going to go into the vein. So here I am, without breaking sterile technique. But before I do that, let me just tie my tourniquet. Alright, get my tourniquet tied. Alright, right here, all perfect. Get my cannula, take it out of here without contaminating it, and my bevel up, and I am going to anchor the hand right here. Make sure I'm holding onto the vein so it doesn't roll, and I'm going to go into the vein. So I'm in the vein, and if I don't get blood right